Good evening, everyone, and thank you for joining us today. We are excited to have you all here for another wonderful patient webinar, The Future of Glaucoma, Dropless Therapy. My name is Gabriel Macias, Business Development Manager for Harvard Eye Associates. It is my pleasure to introduce our presenter for this evening, Dr. Savak Teymoorian, Premium Cataract Surgery and Interventional Glaucoma Specialist. Dr. Teymoorian is a board-certified ophthalmologist who specializes in both premium cataract surgery and interventional glaucoma at Harvard Eye Associates. Dr. Teymoorian provides patients with a full range of eye care in these areas, utilizing the newest advancements in technology and services available for these diseases. For patients with cataracts, Dr. Teymoorian individualized planning and care is tailored to maximize options with vision goals. For those with glaucoma, Dr. Teymoorian can offer the full range of possible treatment therapies, such as pharmacological, laser, injection, and surgical methods, including the use of minimally invasive glaucoma surgery. And for those patients with both cataracts and glaucoma, he can uniquely combine specialized treatment options to address each simultaneously to enhance visual outcomes. Dr. Teymoorian, thank you so much for being here to host tonight's patient webinar.
Great. Thank you so much, Gabe. I appreciate the introduction and good evening to everybody here on the webinar. Thank you for taking time out of your schedule to listen in here. My name is Dr. Teymoorian. For those of you that are my patients, I go by Dr. T. One thing that I'm super proud and honored about is having the opportunity to speak in front of you guys tonight. For those of you that are our patients, it's great to see you. For those of you that are not our patients and are just tuning in for the first time, we welcome you to Harvard Eye Associates as a group. Just as way of background, we've been a company around for over the last 50 years. And no, as my patients ask me, I have not been around for the entire 50 years, but we've been around the community taking care of our patients and their visual needs, and we cover a large spectrum of eye care needs for patients. So if you are interested, you have questions, please feel free to look into more into us. But most importantly, what we really enjoy doing about once a month is spending some time with not just our patients, but those of us in the surrounding community, educating them. We really consider that to be one of our core values, is to be able to give back to our community, which is why we do these sessions. So feel free to get connected with our marketing teams. So if there are future seminars that may interest you, we provide them here for you, and we're always open to opportunities or thoughts about topics that you may want to discuss. Now, with those legalese out of the way, what I would really like to get into here is glaucoma. And this is something that I have an incredible amount of passion about. One thing I've really started to appreciate the longer and further I get in my career is just how fortunate I feel to be able to take care of my patients and their visual needs. It truly is a blessing where people are able to give basically their visual responsibilities to us as their eye care providers. And whenever I'm given that challenge, I take it pretty seriously. It's something that I focus my life on, it's my craft. And I spend a lot of time trying to get better and better every day. For those of you that may be familiar, I'm a big fan of the Kaizen philosophy. It's a Japanese philosophy where incrementally you just try to get better every day. It's not about making a big jump, it's just a little bit better every day. And each of those little bits eventually adds up to something really great. So I really dedicate myself and my work to glaucoma. And I hope this information is valuable to you overall. And really, anytime we're presented with something, it's an opportunity of getting a little bit better. But in the process of getting better, we have to be able and open to change. There's that famous saying of everybody wants progress, but no one wants change. And glaucoma is nothing different than that. So, really, what I want to challenge you guys on tonight is let's think about what exactly is glaucoma? How have we been treating it? Where are the areas of opportunity? And what things can we do to really best take care of our patients? Really, there's a guideline of what we're going to talk about tonight. It's just the fundamentals of sustained release. So, obviously, you guys are all here on this webinar. The title is Dropless Therapy. You guys are familiar with using eye drops for glaucoma, but for one reason or the other, you're on this seminar tonight. So, maybe it's a sense of frustration or difficulty with your drops, and you're looking to see if there's something else that we can do. And that's what the entirety of this talk is going to be about. Are there areas of opportunity where we can do better? Again, that Kaizen philosophy of incrementally a little bit better every single day. We'll talk about some of the types of sustained release that are either available or we're looking into in terms of research in the future. Then we'll really focus in on what's commercially available. Where do we use it in our glaucoma treatment? We call it the paradigm or the algorithm, or basically it's our patient journey. And then what are good patients in terms of that fit this technology? What are patients maybe we don't think would fit this technology? And at the end, we'll give a little bit of information about data for those of you that are academic in nature. But really, let's talk about this the fundamentals of sustained release. And this to me is probably the most important slide. We do all this, or at least I do all this. I dedicate my time, my career, my craft is to better take care of our patients. This is what it's all about. And again, I feel incredibly blessed that every day I have patients coming in, really putting the responsibility of their vision, their glaucoma in my hands and asking my advice and guidance on what's the best thing to do. And we'll talk about a lot of different strategies of things that we can do for glaucoma, but I don't want to really take away from what the most important thing is. One thing I've learned in life is keep the main thing the main thing. And really, the main thing here in glaucoma is we want our patients to have really good vision all the way throughout their entire life. And if we're able to accomplish that, then we're successful in what we did. And I'd love to tell you that taking care of glaucoma patients is a lot like the weather in Hawaii. It's going to be all sunshine and rainbows. It's not going to be. We're going to hit some obstacles along the way. And the question is, how do we deal with those obstacles? And that's just like life with everything else. You know, you're going to hit some challenges. Who do you want on the journey with you? How can you best work with them? And then how can you really get the best outcome? And again, that's why I think it's such a great honor to be able to work with patients to be able to do that. Now, we'll talk a lot about here in the upcoming slides about ways of treating glaucoma, but at the end of the day, we do everything we do so our patients get the best visual outcomes. And there's a couple of sustained release products you see here that are pictured with patients that we've done recently before. And again, I want to give a special thanks to everybody out there that allows me to take care of them. Thank you for allowing me to do that. It really does mean a lot. So let's talk about just the different types of sustained release and really just take a step back. We know glaucoma is a disease of the eye where it's associated where the pressure is too high. And imagining an eye that's like a basketball, we don't want it overinflated, but we don't want it underinflated. The problem is when it's overinflated with pressure, it causes stress to very delicate structures within the eye, one of them being the optic nerve. The optic nerve is what the cable line is that relays information from the eye to the brain. Now, we know that through medication use, we can reduce the pressure of the eye, also known as the intraocular pressure or the IOP. The question is, how do we deliver that drug therapy to the eye? And if you ask 100 glaucoma patients, how do you treat glaucoma? Almost all of them will be glaucoma drops. And yes, that is the way we used to take care of glaucoma patients. But are there other avenues or approaches where we can deliver the medication that's better? Again, going back to that idea of can we get a little bit better today? And are there opportunities and are there products or techniques that are available that we can maximize that? So we talk about different types of sustained release. Basically, these are methods of delivering medication in a sustained format that don't rely on you actually having to put your eye drops in every day. And really, the best way to think about it here is the different places where we can put them. And these are going to be the scientific terms. The first one's going to be intracameral. That's the photo here on the left. That's going to be medication we actually put into the eye. If you'll notice down below at about 6 o'clock, you'll notice a white little fuzz mark right in there. That's actually a pellet of medication that's within someone's eye. It's behind the cornea, the clear part, and in front of the iris. That's the first option, intracameral. The next one's going to be intracanalicular, and this is going to be where we put medications into the little punctal system that connects your eyes, that connects to your nose and to your mouth. For those of you that are familiar with dry eye treatments, you may get punctal plugs where the doctor puts little plugs into the tear duct right in here. It's the same area where we can put sustained release glaucoma medications to help deliver it to the eye. And the other avenue that we're looking at here is can we deliver this medication at the time of surgery? For those of you that are familiar with cataract surgery, we take your old cataract out, the lens of your eye. We put a new lens in, known as a intraocular lens or an IOL. And we're working on technology where at the same time we're implanting that IOL technology, there's medication for glaucoma treatment right on it. Most patients need cataract surgery at some point in their life, so we naturally want to take advantage of that opportunity when they're having cataract surgery to also develop a drug delivery system to them. Now, the latter two of those options, the intracanalicular and the intraocular lenses, none of these are commercially available. They're currently under research. I just put it out there just so you're familiar with it because I want to talk about not just technology that's available today, but what are things that we're looking at in the future. And this is something that I think it's really important for me to share with my glaucoma patients. I'd love to tell you that I have the entire journey of their glaucoma treatment all mapped out from right now to all the way to the end. But the fact of the matter is that's not the way life works. Everything is constantly changing here over time. You have to be okay to live in a space of gray. Glaucoma is not really a black and white disease. It's a very gray kind of it depends disease. And you have to realize that as much as we'd like to prepare and have every single step in the journey already outlined for you, we also want to be nimble to things that are new that are coming out that may actually be a better fit for you. What I really like to do now is just focus on what technology is currently available. That way we can talk about what are some opportunities we can address. So we're going to talk specifically about the first category there. That's going to be the intracameral sustained release. So there's actually two products that are commercially available. The first one here is Durysta. This one actually came out right in the middle of COVID, which may have been a reason why you didn't hear about it at first because we had a lot of other things going on our plate. But let's talk a little bit about Durysta. This is actually the same drug medication for those of you that are familiar with the Lumigan eye drops that you use one drop at night. Now, typically, when we start patients with glaucoma drops, we tell them, here's a medication. I want you to use one drop every single night, right? Now, the question here is there some other way we can deliver that medication to your eye without you having to put the drops in every single night? Well, that's what Durysta is. And I want you to imagine a small little tablet or pellet, which is about a millimeter in length. That image here in the middle is a much magnified version, but that's what it looks like, a little tablet. I like to describe it as an antacid. This little antacid medication we place into your eye. It sinks in your eye like an antacid and gradually dissolves over an extended period of time. The good part about this is number one, you're getting medication in your eye. It takes the place of your glaucoma drop, and you're getting it continually. Not just at nighttime when you get a big bump of it because you're putting an eye drop in, but it's sustained release. You're going to be getting this medication 2 o'clock in the morning, 2 o'clock at night. Much like an antacid, it's just going to actively just dissolve over a period of time. The way it actually looks like in the eye, you'll sort of see that picture here on the right-hand side. We call that the gonioscopic view of the eye. One thing is when we're talking about the eye itself and the drainage system of the eye, sort of where the fluid is not filtering through as much, it's actually located in the circumference of your iris, the colored part of your eye, in a 360 degrees circular fashion. To get a really good view of it, though, we don't see it straight on, even using our microscopes in the office. We have to use a little mirror, almost like looking through a rear view mirror to actually get a look at the drainage system. So you'll see here on this third picture, that white little dot right there is a Durysta pellet that sits in the on a spot on view. This is what you see. Now, sometimes that little Durysta pellet can actually change shape. Originally starts off as a little cylinder that's about a millimeter in length. It can either get smaller or it can actually change shape a little bit, turn into a basketball like this. But really, under a magnified view, you can see it, much like a little antacid sitting in a glass of water. But for this one, it's sitting inside of your eye and it's dissolving over a period of time. So you're actually getting medication to your eye consistently without having to put your eye drops in. The beauty of that is it's continual release. Now, there is another product that's available. This is called iDose TR. It's made by another company here down in San Clemente. Actually, the manufacturing company is plant is here. This is a different way of delivering medication to your eye. Same idea though, glaucoma medicine in your eye that gets released over an extended period of time. Now, the first product, Durysta, was a small little tablet that dissolves over time. This one's a little bit different. It's actually a canister of medication. Now, this canister is incredibly small. It's about 1.8 millimeters by a half a millimeter, very small. But within this canister, there's actual glaucoma oil that's very concentrated inside of it. And at the top of the oil is a little membrane that sits there. And this little membrane allows this oil to slowly be diluted or eluted over a period of time. They have really good 2 to 3 year data on it. So imagine a small canister within the eye that has special glaucoma medication in it. And it's the same medication for those of you patients that are familiar with the older medication Travatan Z. This is actually travoprost. It's a travoprost oil that sits in there and gradually gets eluted over an extended period of time. So the first one, the Durysta, is a tablet that sits in your eye. This one is a little canister that sits in your eye. Now, a lot of people ask me, well, what's this canister made out of? It's actually non-ferromagnetic titanium. What that means is the body is inert to it. It's not going to respond to it or react to it. Or if you have an MRI or go through security at TSA, you're not going to run into issues with it. What does it actually look like when we're looking at it in eye? This is the frontal view of it. You'll notice it's just that small little area right in there. This is with the patient's eye being really wide open. Most of the time, the eyelid is sunken down a little bit. It's actually covered by the eyelid. And under that same gonioscopic view that we talked about using that special rear view mirror on exam with a magnified view, this is what it looks like, where the canister is embedded into the drainage system. And at the top of it is the cap with the little membrane. And at that little membrane is where the oil slowly gets released over a period of time. So again, the same idea. You're getting glaucoma medication in your eye. You're not having to put your eye drops in, and you're getting a continual release of the medicine exactly where the medication needs to be. Because really, where the issue of glaucoma is the drainage system is having some issues. And again, the drainage system is located in the circumference all the way around the iris of your. So, why do we do this? Okay, and we'll talk about some glaucoma studies, and a lot of patients are interested in that. But I'm sort of a let's take away what's the big picture here. To do well with glaucoma, there's two things we really have to do well. Number one is we have to bring the eye pressure down. Number two, which I think is more challenging, is keeping the pressure down. I think bringing the pressure down is the easier part of the two because when patients come in, I'm sure you guys will attest to that, we diagnose you with glaucoma. It's definitely a scary thing to be told that you have. You're very motivated to be good with your treatment, and we have treatment options. We can bring the pressure down. It's sort of like the first couple of days you decide to get into shape and think it's a good idea to go to the gym. First couple of days, very motivated to do that. The difficulty comes in though, can you sustain going to the gym? Can you sustain keeping the pressure down? And that's where the true trouble of glaucoma drops comes in. And that's where I really want to talk about where is the opportunity for glaucoma treatment now and in the future. Although we have treatment options like glaucoma drops, they get in the way of us constantly being able to keep the pressure down because there's a couple of key hurdles that we run into with glaucoma drops that make it very difficult for our patients to get drops in every single day. And I get asked this quite a lot of times. What does it mean to be good with my glaucoma drops? A lot of people think, if I'm using my drops more than 50% of the time, three quarters of the time, that's really good. That's actually not really where we want it to be. Really, you can miss one eye drop a month. And I know that sounds very crazy. Like, that's a lot. I mean, that's really good compliance with your medication. But that's what it takes to be successful with glaucoma because, as all the studies have shown, to do well, you have to bring the pressure down and keep the pressure down. The problem is every time you miss your drops or it's delayed, or you think you got the drops in, but maybe it went down on your cheek. I'm sure you guys are familiar with that. Or maybe you had a big meeting the next day and you didn't want your eyes to get red. So maybe you didn't use the drop that night. That allows the eye pressure to go back up. That causes more damage to the nerve, right? So you have to be very consistent with getting your medications in. And those are the hurdles that we hit with glaucoma drops. And that's where that idea comes with how can we deliver drug therapy to the eye, but bypass the key barriers that get in the way of patients using glaucoma drops. And that's probably one of the reasons why you're on the seminar call, because you realize dropless therapy sounds interesting to you. There's something within that that's resonating with you. And this is the part that really troubles me as a doctor. We have patients that are scared about losing their vision. They're incredibly willing to do anything they need to do. And we have treatment options like eye drops, but that ability to simply get the drops into the eye successfully, we run into multiple barriers that don't allow us to get that goal of keeping the pressure down. We really have to eliminate all the barriers that allow or prevent the patient from getting their drops in. And if one of those things comes up and interferes with the patient of not being able to get their drops in, we fail them. And that's where that idea of sustained release comes in. Can we deliver medication in a different way where it bypasses these barriers, but the patient's still able to get their medications? Let's talk a little bit about some of these technologies, the Durysta and the iDose. So these are products that are available. The labeling on them, they're meant for people with high eye pressure. Obviously, we're treating glaucoma. At this point, after the FDA has reviewed them, they're a once in a lifetime's use. So I get asked this a lot. Well, what happens when my Durysta runs out or my iDose medication runs out? The good news is I always have options for you. There are other options we can integrate that are not drop related. We have lasers in the office we can do. We have minimally invasive glaucoma surgeries. We refer to them as MIGS or procedures. We can do at the surgery center that we can incorporate with these technologies to get you a really good outcome. And I don't mean to be light of it, but the way I think about it is, and I'm a big food person, it's sort of like going to a restaurant that you've heard a lot of good things about. Part of it is going there because you're trusting that this restaurant is good. It has a good reputation. But once you get in there, you have to let the chefs sort of be the cooks in the kitchen and create something for you that's really good. And that's what I try to do with each of my patients because every one of them is so different. Their desires and needs and wants are going to be different. I try to tailor my approach to their glaucoma treatment to what matches them the best. The beauty is we have a lot of different options to pick from. It's just a matter of how do we incorporate these things together to get the best outcome. So, although some of these products only have a once in a lifetime use, yes, but that doesn't mean there's no place for them because when you think about it in the big picture of combining them with different technologies, it actually plays a key role. Now, with regards to the length of the treatment, the way things are labeled online, these are very much formulated by what the FDA has, isn't necessarily what we see in practice. I can always say, yes, this is what stated how long a product should work. But the good news is I have a vast amount of experience specifically with these two products where I can say in practice, in my own hands with my patients, how long does it naturally work? So with the Durysta, the labeling on that from the FDA should work for about 15 to 16 weeks. I found in most of my patients, though, they usually last for about 1 to 2 years. So each one of those little pellets that we put into your eyes will get an extended use. This isn't something where you need to come in every month and I give you the medication. So usually once we put it in, it lasts for an extended period of time. For the iDose therapy, there's really good 2 to 3 year data for each of the canisters that's available. And I'll show you some of the data there at the end. So when you start thinking about even using just those two products, and by the way, when you use one, Durysta or iDose, you can use the other one. One doesn't prevent you from using the other one. When you start mixing just those two things together, you can buy about at least 5 years worth of treatment with those two options. When you start integrating it with other things like lasers in the office or mixed procedures, or for those of you that may be familiar, we actually use cataract surgery to bring the eye pressure down. We consider cataract surgery to be our first line glaucoma treatment because for most patients, just having that surgery brings the pressure down. When you start incorporating all of these things together, you realize there's a lot of things that we can pick from. It's just a matter of lining them up for what's best for you. And that's really the beauty of what I get to do every day is how do I sequence these glaucoma treatments for my patients? And I'd love to tell you that we can take an easy approach like cookie cutter care for everybody. But the fact of the matter is not two patients are going to be similar to you. There's really two broad classes of glaucoma. There's an open and closed angle, but there's actually over 40 different types of glaucoma, right? And even if two people have the exact same type of glaucoma, when they present to us for examination, how far along they are with their disease, how bad is their pressure, how much family history of glaucoma they have, you can't even cookie cutter those two things together. The beauty here is we can use each of these technologies to really integrate it into a unique person's experience to figure out what's best to do for them. So, really, where can we use the sustained release? Like, where does it fit in our treatment algorithm? It's going to be anywhere, all the way from people that are early on disease, we call them glaucoma suspects or ocular hypertensives, all the way people who have very late disease. And just as an explanation, people who have ocular hypertension or OHTN, these are people who have very high eye pressures, but don't have glaucoma damage yet. So the best way to think about it is someone who comes into the emergency room, their blood pressure is 230. Well, they haven't had a heart attack yet, but you're not going to wait for them to have a heart attack, right? That pressure is too high. That's what we see here with patients with ocular hypertension. Their eye pressures are too high, but they haven't had damage yet. So although they haven't had damage, we still want to go ahead and treat them. So now let's move on to where exactly does sustained drug therapy fit? And I sort of talked about this before. Delivering medications to the eye works well if we can get the medication to the eye. But the problem is when we're dealing with glaucoma drops, patients run into a couple of key barriers. Well, what are those barriers? Those barriers are going to be costs, side effects, remembering to put them in, and also applying them. Let's talk a little bit about the cost of the medications. This is probably the most frustrating one that I hear about all the time. Patients come in, they have glaucoma, they're eager to get it addressed. We have drug eye drop therapy that's available for them, but then they go to the pharmacy and the medication's not approved, or they have to go through an extensive prior authorization. So even though there's actual drugs that are available, our patients don't have access to them. They're too expensive. And I get it. This isn't a bottle of medicine I ask you to get just once and your glaucoma's cured. This is a bottle of medicine you got to get every single month. And when you start adding up months and years of treatment, it becomes unsustainable. So, although we have patients that are very motivated to use their drops to bring their pressure down, cost is very, very important. And even if they are able to get their costs in, patients have to remember to put them in. Now, we talk typically about glaucoma drops being used one drop at nighttime. But for most patients, they actually need two or more types of drops to manage their glaucoma. There's several studies that show that. Well, once you get into two or three drops, patients are putting their drops in 3 to 4 times a day. I hardly remember to eat 3 to 4 times a day, let alone do anything 3 to 4 times a day. But every time the patient misses their drops or it's delayed, especially the middle of the day dosing, patients have a problem. You can imagine when you wake up, you'll remember to put your drops in. When you go to bed, you can remember to put your drops in. But sometimes we ask patients to put their drops in at 12 o'clock or 2 o'clock in the afternoon. Almost always patients have a hard time with that. In fact, it's such an agreed upon problem for us as eye care providers that even though there are eye drops that are available that are FDA approved for 3 times a day use, we don't even start patients on 3 times a day. We just say use it twice with the assumption they're just not even going to get the middle of the day dosing in. That's how much it's deep in our conscience that there's issues with drops. But before there was this sustained release technology, these mixed technology, we had to be okay with that because although there was opportunity to be better, we didn't have the technology, right? So let's say you're able to afford them. Let's say you're able to remember them. The reward of putting your eye drops in for a lot of people, they just continue to use more eye drops right afterwards in the forms of artificial tears. The glaucoma drops, they're great for your eye pressure. They're very toxic to your cornea, the front surface of your eye. They can cause your eyes to be red, irritated, dry. And the number one reason for people having blurry vision overall, I'm not just talking about glaucoma, I'm talking about just blurry vision overall, is dryness in your eyes. And that's not unusual to get as you get older. And that's a frustrating side effect of glaucoma drops. You're just trying to do good by getting your drops in every day, but you're getting that side effects of dryness in your eyes. So not only are you having to put a couple of glaucoma drops in 2 to 3 times a day, you're then chasing those drops with artificial tears, maybe 5 to 6 times a day. Now all of a sudden you realize your whole life is revolving around getting eye drops in every day. And remember what we talked about earlier, right? We focus a lot about the pressure and how do we treat that for glaucoma. But at the end of the day, we're just trying to take really good care of our patients. We want them to have great functional vision throughout their entire life, but I also don't want them living their life just to get their drops in, right? I kind of want to be the referee of a sporting event. I want to do my job and let my patients be the players and just play the game without me being noticed, right? But if they're having to stop multiple times a day to put either glaucoma drops in, artificial tears in, I'm really failing them because they're almost chained to having to put their drops in. They're not able to go out and just live the life they're trying to live. So these are the key issues that we run over with drops. And this is why we think about sustained drug delivery. If a patient's having an issue with these or any one of these things, and it's getting in the way of getting the drops in almost every single drop, remember you can miss one drop a month, then we need to talk about some other ways of delivering the medication. And again, there are ways of delivering the medicine to your eye, but we have to think about it differently. Back to that idea of everybody wants progress, but nobody wants change. So for us as providers, we need to be okay and adaptive and open to learning seeing are there ways of doing this in a better way. And it's on the patients as well too to also be open and adaptive to, we know we've been treating this with drops before, but can we be doing this in a better way? And I'm not going to say that all of these sustained drug deliveries are right for everybody. Absolutely not. That is not the case. Certain deliveries, whether it be sustained drug deliveries or eye drops or surgery, they're going to be right for different people. The most important thing is that we have an opportunity to talk about it. That way we can figure out and game plan what's the next right step thing to do for your journey, because everyone's a little bit different. And I'd love to tell you that I know everybody 100% really well. And we don't even need to have a discussion about these things. But the fact of the matter is, our time together is always constrained, right? So please share with me what's important to you. What are the key issues you're running into? And then let's bypass these barriers. Whether you're seeing me or another eye care provider, they should routinely, as a glaucoma patient, be asking you, how are you doing with your drops? And I'd love to tell you, and I run into the same issue too. We're kind of people pleasers. We want to say, yeah, everything is great. It's not a problem. But the difficulty with that is if you're really not getting your drops in every day, the only person you're hurting is yourself. And I'm not going to be upset with my patients if they say, look, I'm not getting my drops in every day. My responsibility is, well, what are the barriers and how can we get past that? I'm not here to browbeat a patient. I'm here to spend the time with you in the office to troubleshoot these issues. But if myself or another eye care provider is having a hard time identifying what the problem is to begin with, we can't spend that time together in a good way to actually get them addressed. So, one thing I'd like to really challenge patients is please, if there's an issue with your drops, express them, because there are other opportunities or ways of addressing this that doesn't necessarily need to rely on drops. At least have a discussion about it so we can get the best care for each and every one of you. Let's talk about where sustained drug release maybe isn't good fits, and these are going to be more issues that your eye care provider will talk to you more about. You know, some of the medications that we use, if you have other issues in your eye that have macular edema, or this is swelling of the macula, which is the back of your eye, your retina. Typically, we want to stay away from these medications because even in the form of sustained drug release or drops on your eye, they can cause the swelling of your eye to get worse. The other things that we notice here is going to be iris pigmentation. And what that means is for some people, the color part of their eye can darken. Typically, not an issue if you have a brown iris, but for people with like hazel or blue eyes, on a rare occasion, it can cause pigmentary changes. Now, one thing I do want to say, it's a myth. When you read stuff online, you'll read about iris pigmentation and glaucoma drops. That doesn't mean 100% of the time your iris will change color. That happens very rarely. Not that it doesn't happen, but it happens very rarely. But for some reason, that's an issue. That's something to bring up. Other issues that we can run into is just sensitivity to the actual medication or corneal issues. These are issues to the surface of your eye, and those will leave to your eye care provider to be able to filter out for you. It's going to conclude here with just a couple of studies. You know, for those of you that are interested in that, you know, these are the studies for the Durysta and the iDose. Really, what they show is they're effective in bringing pressures down. These are some of the landmark studies that we talk about, or pivotal studies. Specifically with Durysta, it's going to compare the actual Durysta implant, that's the bimatoprost implant, versus timolol eye drops. Just as way of background for all of our glaucoma studies, we always compare anything new in glaucoma versus the eye drop timolol. It's sort of the gold standard of the way we do it because that's the way it's done. That's the way the FDA reviews things. You know, if you look at this chart right here, you'll notice that the Durysta tablet works the same, if not even a little bit better than the timolol medication eye drops. What isn't easy to see though here with this chart, this just shows the pressure of the eye. This doesn't show in practice the difference between those two. Remember, the timolol drops or drops in general, if you're on them, you have to use them and get them and afford them and tolerate the side effects twice a day. With the Durysta, the bimatoprost implant there, you don't have to deal with those issues. The medicine's already in your eye being delivered, sustained release, morning, noon, and night. And that's something that's not easily be able to seen on these slides right here, but it's a very key point. Remember, it's that idea of not just bringing the pressure down, but also keeping the pressure down. And I've been fortunate to do a fair amount of these. So there's studies I get asked all the time, what are my patients doing? How are they resulting? You'll notice here, these are things that have actually been published for My patients that have lasted more than 3 months, we actually have data published out to 1 and then 2 years that showed that the medication brings the pressure down, and for a majority of them, keeps the pressure down. Probably the most important thing, though, is this study also shows how much we're able to reduce the number of eye drops for our patients. Remember, the key is not so much even to bring the pressure down, but is to eliminate the eye drops. So, what do I mean by that? There's not just one goal we have with these sustained release products. It's not just to bring the pressure down. Sometimes we do it because we want to keep the pressure the same. It's actually a good pressure. I just want to either eliminate or minimize your eye drops, right? So there are patients where we do this because we need to bring the pressure down in addition to their drops. And there's other people where just want to keep the pressure right where it is because it's a good number, but they're having these issues of costs and side effects and remembering them, and we want to eliminate those medications. It's those quality of life things. I'm pretty sure most of my patients will say their quality of life is improved if a doctor actually takes them off of some medication. And I know that sounds revolutionary because as doctors, we're great about adding more medicine and adding more medicine and adding more medicine. Next thing you know, you got a laundry list of medications that you bring to all of your physicians to see. But we do a terrible job of actually removing medication. And here's where sustained release comes into play, or mixed glaucoma surgery comes into play, or cataract surgery comes into play. And again, where we can incorporate all of these different approaches to glaucoma in an interventional way, that way we can keep your pressure down without having to solely rely on the actual drops themselves. And that's really what interventional glaucoma is. I know some of you guys reference that or ask me, what does that mean you do interventional glaucoma? It's just, I'm a big believer that treating glaucoma goes beyond eye drops, that there are better ways we can incorporate interventional things that take the responsibility away from our patients and put it on us as the providers to provide some kind of intervention that allows us to, number one, get the pressure down and keep the pressure down, but ultimately, at the end of the day, keep our patients' quality of life the highest it is. But as much as that requires work on me to stay up to date with what's available, it also requires our patients to be open and receptive to thinking about other ways of treating their glaucoma besides eye drops. And here are going to be the studies for the iDose too. It's going to be consistent with what you're seeing from before, basically comparing it to timolol, and you'll notice that it's effective when compared to timolol. So these things actually work. And again, takeaway slides here is most patients at 12 months are still doing well, either completely off of drops or minimizing their drops. So they can not only keep their pressure down, but not have to worry about actually putting their medications in every day. And just to conclude here in our talk, it's always a privilege to be able to take care of glaucoma patients. It really is. I love my cataract patients and I love my glaucoma patients a lot. The reason why I like the latter group a lot is I get to see them frequently, typically every 4 to 6 months. You know, after a couple of visits, we've already had our discussions about what glaucoma is and what the treatment is. We really get an opportunity to get to know each other. And this is good because it helps me get through the day because I'm seeing patients. I get to enjoy spending time with them and seeing what they're up to and hearing about the awesome trips that they're taking or the new grandkids they have. But it also helps me learn a little bit more about them. That way, in this glaucoma journey, when we reach our challenging points, and notice I said when, not usually if, but when, I know more about them, so I can really tailor the treatment options that best fits for them. You know, for some people, surgical options are the best options. For some people, surgical options would be the worst thing we could be doing. But the beauty here is the more I get to spend time with my patients, the more I get to know them, the more I can really tailor my treatment options to them. That way, we can accomplish what we were trying to do in slide number one, right? Really maintain a high quality of life for our glaucoma patients and being the referee of their game and not getting involved in their life, letting them live their life, but letting them live their life fully with really good vision in the most productive way that we can think about. So what I challenge you to do is think about it when you're seeing your doctor for glaucoma and you're on glaucoma drops. If you are having issues with drops, please feel free to bring them up. That responsibility I will put on you. Our responsibility as your eye care providers is then to take that information, work with you, give you some different options of things that we can talk about, and then figure out if any of these other therapies are a good option for you. So if you're having issues with cost of the medications, side effects, remembering them, or just actually being able to put them in, bring them up so we can work hand in hand to get these things addressed. Well, again, I want to thank you guys for your time. I appreciate it. Hopefully, you found this insightful. If you have questions, you can leave them down in the chat box below.